Welcome to the next in our series of Heart and Chest Matters, where we hear from some of the team who provide and support specialist heart and chest care for patients and families at Liverpool Heart and Chest Hospital. Today our guests are Principal Clinical Psychologist Dr. Joe Jury and Associate Psychological Practitioner Olivia Parry. So happy New Year to you both, and thanks so much for coming on the Heart and Chest Matters podcasts. And I think it's probably helpful to start things off by explaining a bit about your psychology roles and how you're both involved in supporting patients. Is that okay?
Yeah, sure, of course. So clinical psychologists are people who help other people understand how they think, how they feel, how they behave, and how that all links in together. So we might work with people who are struggling with low mood, with anxiety, with adjustment difficulties if they've had a diagnosis that they found particularly difficult, or we might work with people to improve their quality of life, so think about all the things that they like to do in their life in order to get the most out of life, especially important when you've got a long-term condition that might feel like it's limiting you in what you can do.
I think my main areas is really like patient focused and doing kind of one-to-one sessions, group sessions with patients who are struggling with their kind of mental health due to their physical kind of health condition, what they've been diagnosed with, help them kind of understand better what they're going through, why they may be feeling certain ways, and help create kind of coping strategies.
Is that in person at the moment, or is that mainly online?
A lot of what we're doing is online at the moment.
We've both got clinics, haven't we? And we see people where we need to see people face to face, because we know that for some people there might be a whole load of reasons why they can't access either video or phone, whether it's social circumstances, maybe they haven't got the space at home, or they don't feel safe at home to talk about difficult emotions. And for some people, we know they might have hearing difficulties, visual difficulties, issues getting hold of technology, all those things that we know limit people. So some of what we're doing is also in person, but lots of it is being delivered over the phone or over video.
Okay, so it's now the middle of January, and around this time of year there's often news and stories in the media about mental health issues and Blue Monday. What is Blue Monday, and why is there this sort of focus in January?
Yeah, January can be a difficult month. I will disclose that my birthday has fallen on a Blue Monday before. So I'm coming at this as somebody whose birthday is at a difficult time of year for a lot of people. So Blue Monday for me is a little bit of a personal thing. Have a little bit of an issue with it. Just in terms of it kind of is positioned as being this one day in a year where everybody is going to be at their most miserable. And actually we know that that's not really the case. I think it's helpful to think about there being a day when we can stop and think about our mental health. Gives us an opportunity to maybe reflect on how we feel after Christmas and it coming into the new year, and all the things that can be quite difficult for a lot of people around this time of year. And I think January, for a lot of people, there's New Year's resolutions, isn't there, around kind of improving themselves and making themselves a better version of who they are. So a lot of people might be thinking about taking on exercise, or trying to lose a bit of weight, or trying to take up a hobby. And that can be a good thing, and it's a time for reflection. But what that means is it's also a time when people have got an extra pressure on themselves. They're trying to take on all these new things maybe, and then we know about New Year's resolutions, don't we, that generally they tend to fail after probably around about this time of the year, about 13 days in. People start noticing. Your own resolutions? I don't make resolutions for that very reason, is I won't put the pressure on myself to have something that then not long before my birthday I end up giving up on and then feeling bad about myself. And that's the joy of doing the job that I do, is I have that bit of insight that actually I might do some things differently, but it's not necessarily a New Year's resolution. But I think this time of year particularly can be difficult. I know there's a lot of people who might be listening who are struggling with those kind of post-Christmas blues. Maybe Christmas has been a difficult time, particularly over the last couple of years as well. Maybe feeling isolated. Maybe plans have had to change. They're coming to the new year and it's cold. We've got a lack of daylight. We know that things like vitamin D are really important for people's well-being, as well as being outside in the fresh air. We're maybe being less social. Take away from the pandemic anyway, this is a time of year where people are maybe kind of hibernating a little bit more. People haven't got as much money as they might have pre-Christmas, so being able to go and have a coffee with your friend in the coffee shop or go down the pub, actually people may be less able to do that because they're waiting for payday. That lull after Christmas, even if you have had a good Christmas, you maybe spent it with family, and then there's a bit of a come down after that. Everybody's back at work and feeling a bit, what have we got to look forward to now? Maybe people have put a bit of weight on over Christmas and they're feeling a little bit sluggish, not feeling quite as healthy as they might do in the summer, getting less exercise because the weather's bad. They maybe don't want to go out, or don't want to risk going out in the ice or things like that, understandably so. There's less of a routine as well. So there's loads and loads of reasons why this time of year is particularly difficult for people. And I think it kind of all culminates into this Blue Monday, which is supposed to be a mathematical algorithm that we've worked out that is the bluest day of the year. But actually it makes sense really when you look at all the factors that could possibly mean that it is difficult for people at this time of the year. But we're human beings and we're so much more complex than just being able to put a few things into an algorithm and work out that whatever day of the year is the worst day of the year for people.
So would you say that instead of focusing on one day in January, actually it's much more important to be aware of these issues throughout the whole year, recognising signs, symptoms and triggers, so whether that's January or in the middle of July?
Obviously this particular time of year with Blue Monday, it kind of heightens the fact that we would maybe feeling quite low, but you know, we can feel like that throughout the year, and it's always kind of important to kind of notice when you, or recognise when you are feeling like that, because it's not just this time of year, it could be at any point really, definitely.
I'll just add into that, I always say that our mental health is a little bit like blood pressure. We all have blood pressure and we all have mental health. And it comes and goes, and it goes up and it goes down, and there will be times when throughout the day when my blood pressure is higher, sometimes it's lower. Same with my mental health, and that's the same for absolutely everybody. So throughout the year that's going to fluctuate based on your own personal experiences. Some people, for example, summer might be a particularly difficult time for them. So it's not just the case of it just being the winter, but throughout the whole year. So much like we might look after our blood pressure, we should also be looking after our mental health in exactly the same way.
Do you think there's an increasing awareness of these issues then in workplaces, among friends, online and so on?
Yeah, I would agree with that. I would say there's quite a bit more of emphasis at the moment online about that you should be prioritising your mental health and like the benefit to maybe talking to someone about how you're feeling or doing certain things to kind of help and kind of boost your mental health and your psychological well-being. I do think that there is, as I say, a bit more emphasis on it at the moment. It's always a good thing.
Yes, it is. And there's been recent campaigns, isn't there? We think about kind of time to talk, and we think about, there was something on ITV a while ago, wasn't there, where every break time they had something about talking to each other. I saw an advert for, I think it was Walker's Crisps the other day, where it was something about talking to somebody else about how you were feeling. So it's kind of everywhere now, really. There's a whole thing that happened after Caroline Flack as well, after she died. There's a whole load of things out there about being kind to each other, listening to each other, asking people, are you okay? But asking genuinely if they're okay as well. So I think it's done a whole load of good in terms of letting us talk about it. And we use the word normalising quite a lot in what we do. So a lot of what we do when we are with someone who's quite distressed is we normalise that experience for them. It's part of being a human being. Life is difficult. People will experience difficult emotions throughout their lives at different times. But if you can talk about it and seek support in the right place, then that's always a good thing to do.
Now, COVID has impacted so much of our lives, hasn't it? But has it had any particular impact on your areas of work in the last couple of years?
I've definitely noticed anxiety has been a real issue for people, especially for people living with a long-term condition. Understandably, if you're in one of the categories that makes you more vulnerable, if you were to catch COVID, the kind of consequences of that means that people have been quite scared about going out into public, spending time with their friends, even within their own house, spending time with their family, things like that becomes quite something that's, there's a lot of fear around that. So I've definitely noticed that, a lot more anxiety around that. And the usual sort of things we might do with somebody who has experienced anxiety around being in public places, we can't do at the moment, because a lot of this is around supporting people to make gradual steps to build up their activity levels, to build up their facing the thing that they are fearful of. And we've not been able to do that with people, so that has been incredibly difficult. So it's no wonder more and more people are feeling more anxious, because there's not actually loads of things that you can do in order to tackle it.
Now, clearly the most important thing for us to highlight today is help and support. So is there any practical advice that you can share with listeners who, for whatever reason, may be struggling with their mental health at the moment, or any services and resources that you can signpost people towards?
I'll let Olivia add in as well, but I think some of the things that I know are really important, the things that we know that keep people psychologically well, are things like having a routine. So making sure that, so one of the things that I do in order to try and look after myself is that at the weekends I try and keep a similar routine to what I would during the week. So I try and get up at the same time. I try and have my breakfast at the same time I get dressed. I have the similar routine in the mornings, and that sets me up for the day. So that's one thing that we can do. Keeping active, we know as well, is really important, and that can be different for different people. So whether it's going out for a walk at lunchtime, or whether it's maybe putting a YouTube video on if you can and doing some chair exercises, whatever you can do, something really gentle if that's what you're able to do. We know connecting with other people is also really important, so that comes back to maybe online groups, or maybe going out and having a chat with your neighbour if you see that your neighbour's out and you have a good relationship with your neighbour. We know that achieving things as well in the day, having a sense of purpose. So it sounds really boring, but just getting through your pile of washing in a day and having that being a sense of achievement. We know that that's really important. Being productive and having something in your day that you feel like you've been able to, it's like ticking off a to-do list, really. That can be important. We know things like enjoyment, doing something that you enjoy every day keeps you well. Finding things to be grateful for as well. There's loads of, I could go on forever, all the things you can do, but there's loads of things like you're finding things to be grateful for, keeping a gratitude diary. And there's also quite a lot of research coming out at the moment around the role of playfulness. So I think as grown-ups, we tend to lose that kind of childlike element of playfulness and just having fun. And there's some, I can't remember what the stat is, but there's something about how many times a child laughs in a day versus how many times adults laugh in a day. And the difference is just amazing. But things like laughter, not only psychologically are good for us, but physically and neurologically are good. They actually release chemicals in our brain, which helps our body to calm down and helps to keep us psychologically well. So yeah, doing really silly things that people maybe don't want to admit that they do, but you know, just going on a playground and having a swing on a swing if you're able to.
Just have a good laugh.
Just have a good laugh and just have good fun. And it can be difficult to do, and we know if people are feeling low or if they're feeling anxious, those things are quite difficult. So seeking out support with that would be really important. And that's something that our team can do for anybody that is feeling particularly distressed and a lot of people talk about feeling very stuck or feeling like they're in a hole. It's probably a good way to describe it. That's the point where if you feel like you just don't know how to get yourself out of it, seeking that support either from our services or from one of the many services that are out there online or in the community is really important.
Usually when we complete our therapy sessions at the end, we all signpost people to obviously the NHS website is also a very good one to go to. There's Frazzled Cafe, Anxiety UK as well is another good one. They're the kind of main ones that we would kind of use.
There's also like the Mind website as well, which I think has had quite a lot of publicity over the last couple of years. They've got loads of resources on there. I think they publish lots of useful booklets, so there's booklets on there around how to manage low mood, how to manage anxiety, those sorts of things. The resource that Olivia's picked up on there on the Frazzle Cafe is one that I keep promoting to people, so that's like a really nice online group community. And you don't have to have a mental health diagnosis, but it's just for anybody that might be struggling, is having a bad day. You can book onto these free sessions and you can go meet up with other people who are maybe feeling the same.
And then finally, if you had one piece of advice that you could share with those listening, what would that be?
Olivia, what would you say?
I would say that there's people there to listen to you and talk, take advantage of that help that is there, like prioritise how you're feeling.
Mine would be around the kindness thing. I think I've really liked seeing that come in the media, the be kind to each other and be kind to yourself. I think we quite easily will beat ourselves up, or if we're having a difficult time, we think we should just somehow snap out of it. But actually, when you stop and think about all the things that contribute to somebody's well-being, it's often really understandable why somebody's feeling the way that they're feeling. So if you can remember that and try and speak to yourself as if you would speak to a neighbour or a loved one or a friend, and just give yourself that kindness, that's really important.
Yeah, that's something I say a lot. If you were talking to a friend, would you say this to them? A lot of people would say, well, no, I wouldn't talk to a friend like this, so I shouldn't be talking to myself like this. So yeah, I think that's a good one too.
Jo and Olivia, Thank you so much for your time today.